We already have folks who are here. So I think some of our folks are returning. For all of you, we get folks who come in every week. And I think they know the drill at this point. But if they don't, if you are one of our participants, our attendees, I'd love for you to open the Q&A and tell me where you're joining us from. So I'm assuming that, Donna's here and maybe Twyla's here. We've had, a few that we see every week. Kim,
I was gonna say, I even remember Donna and Twyla. So
Tammy, I think Tammy's been here before, from Westland, Carter from San Diego, Lake Oswego. Teresa's been here before, Elizabeth from Coeur d'Alene. I think Elizabeth's been here. These are all looking super familiar. So Portland, get a lot of West Coast folks, a lot of folks from Colorado. Jen, I recognize your name from Highlands Ranch. Let's see, Camarillo, California. Good to see you, Alejandra. Chris joining us from Honolulu, Portland, Aliso Viejo, Houston, Texas. Yeah, we're seeing a lot of the same folks. I love it. Karen from Woodlands, from the Woodlands. I'm sorry, Karen. Laura from Lafayette, California. We'll go ahead and have folks keep joining us while we're coming in. If you're just joining us, go ahead and open the Q&A. Typically, we go ahead and we use the Q&A feature instead of the chat, because the chat can get a little bit hairy if we're trying to watch both, and we can get a really good transcript out of the Q&A. So I'm going to ask everyone to use the Q&A here. It looks like we've got folks coming in from Novato, San Jose, lots of folks, Scottsville, New York, San Dimas, California. Okay, so we're going to go ahead and get started. And I've asked our panelists to make sure that they introduce themselves and have each of them give you a little bit of background into what their job is, what their role is at the University of Oregon. And then we'll go straight into your questions and we'll get as many questions answered as we can, which is our typical practice, so that you are feeling more comfortable, more confident, and that you feel good about what you know about the U of O. So I'm going to go ahead and ask Deb to start. Deb, do you want to introduce yourself, your role at the U of O, and anything else you'd like to share?
Sure. Thanks, Cora. Good evening, everybody. I'm Deb Beck. I'm an assistant vice president for our division, the Student Services Enrollment Management Division, and also the executive director of the University Student Health Services. So welcome, and we look forward to sharing more about our services and any questions you might have for us. We look forward to working with you this evening and helping you understand our service a little bit better. So thanks.
Absolutely. I think Marika, you're next, right? I said alphabetical by last name, right?
yeah, I think I am. All right. Hi, everybody. My name is Marika Lin, and I work at Counseling Services. I'm an assistant director, and I also oversee all our education and prevention and outreach. And just know, of course, I'm one of our staff psychologists, so provide those direct services, mental health services for your students. So I'm certainly here to be of support to you and share with you all about our services and resources that be helpful for them.
And last but not least,
hi there, everyone. I'm Shannon Millington. I'm the Director of Ancillary Services here in University Health Services. And so I oversee all of our clinical ancillary services. But for tonight, I'm imagining most of the questions that you'll have for me center around the Student Health Benefits Plan, because that's one of the areas that I also oversee. So hopefully we can lend some clarity to the decision-making process around all things health insurance.
Sounds awesome. I'm going to butt in, and I know we do have a question already in the Q&A, but I'm going to butt in first. I'd love to hear a little bit about your backgrounds. I know that some folks, there are folks who are, professional administrators, and there are others who come out of the medical field into administration. So I'd love to know, have our guests understand a little bit about like where you came into your role from and what your background is a little bit. So we'll just do it in the same order, if you would, Deb.
Sure. Yeah, I definitely came from a medical background. Lots of years of being a registered nurse. My main focus of nursing was emergency room nursing. About 20 years ago, I came into the field of college health and absolutely love it. And so I have 20 plus years of experience in this field. It's been a real honor to be with students and to learn so much from them and to lead health services here at the University of Oregon. So definitely a medical background. I also have coupled my education with an MBA, which led me into the administration part of healthcare. So that's my background. I guess, Mariko, you're next.
Yeah, so I have to say, if I'm anything like one of your students, I started as pre-med and then certainly went a different track. And so I actually knew in the midst of my college degree that I wanted to be working at a counseling center. And so I knew grad school was the way to go for me. So I have a master's degree in counseling, and then I got my PhD in counseling psychology. So, at the base, I am a staff psychologist, but certainly, I have loved to provide outreach services where I'm teaching and facilitating conversations with students when it comes to their mental health. So just beyond like meeting with them one-on-one in an individual setting. And so then I just love what that comes with working in a counseling center and all the different services and resources are offered than just doing a private practice. So that's where I came to be and have been here for 10 years now.
Thank you.
And there seems to be a theme in the room. I am also from a medical background, so I'm a physical therapist by profession and initially worked at outpatient orthopedic clinics, hospitals, skilled nursing facilities all across the country. And like so many of my colleagues in college health, I came upon college health 15 years ago and have never left because it's just been such a great fit. And the enthusiasm that our young people bring it's just a really infectious and wonderful environment to work in. And you have an opportunity to impact their health habits early on, hopefully while they're still sort of in that formative molding stage of their development. And that's really rewarding and exciting for us. And so my background is physical therapy, and just through time and exposure have gained more and more insight into managerial and leadership roles, and have overseen almost every area of the health center, but now am in clinical ancillaries and student health benefits plan.
Thank you all. Okay, so we are going to go ahead and get to our first couple of questions that we have in. Kathy has asked us, are allergy injections available?
The University Health Services does not do allergy injections for our students. So the answer to that is no, but if you want to connect with us, we can certainly help you find resources in the Eugene area so those services can be covered for your student while they're here on campus.
Thank you.
Sure.
So we also have one, so we have a question specifically about the COVID vaccination submission and a student who has already submitted, but it appears as though they've been prompted to submit again or that it wasn't accepted. Can you talk through what how that has all worked? Did something change at the end of July? Did we, a student who might have submitted something in their health portal prior to the end of July, is there other things that a student might need to do to ensure that we have their COVID vaccination record?
So I'll start, and Shannon, feel free to chime in. Shannon works a lot with our electronic medical record, but each student has a student health portal. It's their own private portal in our medical record. And through that portal, you can upload vaccination information as well as other, text us, communicate with us and that sort of thing. But with regard to the COVID vaccine, you would upload dates and upload your card, and then there is a verification process. So one of many things could have happened. There could be a misinformation of dates. It might not have completely cleared our verification process. So there could be a number of things wrong, and probably the best bet would to be reach out to us individually so we can take a look at that record and see what's wrong. It could be nothing is wrong. It could just be a system error, but it could be something just minor as a date wasn't quite transcripted correctly or it wouldn't go through our system. So feel free to reach out to us. Shannon, do you want to add anything to that?
Yeah, sure. So the best place to reach out will be immunization@uoregon.edu, and that'll go straight to our immunization compliance officer. And then she can look specifically into your situation and help provide you information about what might be going on. But in the meantime, while you're waiting for that response to come in, you can log back into your portal and look under the immunization tab, and you should be able to see what you've registered. And so if you see that it's blank, then you know that it's an upload issue, and you should just try to submit that process again. But if you can see your data there and it matches what you think it should do, then I would just wait until you hear back from that immunization coordinator at immunization@uoregon.edu.
Perfect. Thank you. I have put both the health center website and the immunization email address that Shannon mentioned in the chat. So it's a good idea to have the chat open, even though we're asking you to use the Q&A feature for your questions, but this gives you a chance to see the emails and the URLs that we post. So Teresa's asked two questions. So Teresa, I'm going to go ahead and combine those. They're about health insurance. So do we bill medical insurance on a student, if a student is covered under their parents' insurance plan, and what services are available to students, whether they have medical insurance coverage or not. So can you talk a little bit about what's available to students, and then how the insurance billing works, whether they have the UO plan or they're covered under their parents' insurance?
Sure, I'll start maybe with parent insurance, and Shannon, I might transition to you for the student health insurance plan, but all the services at the University Health Center on the medical side. So if you're seeing a medical provider, going to the lab, the radiology area, getting an immunization, those services we bill as most of your own community providers do. So there's a charge for those services. We'll be happy to bill your insurance, your students' insurance. And if there's any patient responsibility due, we'll put that charge on their Duck Web account. And they're informed of all of this when they come in for services. There are services that are part of their student health fee. And those services include our behavioral mental health, Mariko's area. Our counseling services are free without charge under their student health fee. We have a variety of outreach that we do as a part of that health fee that there's no charge for, including our Duck Nest Center for Wellness. So we have a lot of offerings that are free. It's a rather complicated system, so we try our best to spell it out on the webpage, but we do have a student health fee that covers a large amount of services. And I will just mention right here that one of the things it does cover is our nurse line. So when we're not open 7 days a week, we have a nurse line available, so students can call in and ask questions if they don't know what to do while we're closed. We do bill most major insurance carriers in the United States, so we have a list of those on our website, but I would encourage all of you to reach out to your specific insurance company. There can be a lot of plans under one umbrella of commercial insurance. So you need to make sure that your plan is accepted in the Eugene Springfield area, including the University Health Services. And another important component to think about this is if your student decides they want to travel, whether they travel throughout the US or worldwide, and what kind of coverage your student would have in those situations. So there's a lot for you to think about, but I would encourage you to first start out taking a good look at your policy, making sure that you have excellent benefits while your students here in Eugene, as well as the University Health Services, and then how it would work if your student traveled. One thing I would like to put in here is that if your insurance company says you have emergency coverage while you're in the Eugene area, this is really important to ask more questions about. And I use this example because if you feel like you have an emergency, you go to an emergency care unit, whether it's a urgent care or an emergency room, or you might come to us with an emergency. They might cover that as an emergency, but once that visit is over, that emergency coverage ends. So let's use a sprained ankle as an example. If a student has a sprained ankle, they go to an emergency room and urgent care. Yes, it's a sprained ankle, but in order for your student to have the best outcome, they might need follow-up care through orthopedics or physical therapy. Oftentimes, if you have emergency care only in our area, those services would not be covered. So then your student would be in a position of either not getting the services that will make them their best or having to go home for those. So that's an example of something I want you to be cautious of when you talk to your insurance plan. And then I'll let Shannon add to that because the student plan does offer some of the benefits that your plan may not. So she can talk about that a little bit.
Yeah, so Deb touched on this. It's a really important point. We want all families to first start with your plan, see what it covers, and see how well it works. And on our website, there's a tab called Understanding Health Insurance to help sort of reiterate some of those important pieces about health insurance and what questions you should be asking your health carrier. But let's say when you call and do your due diligence on your health plan, they don't have good coverage in the Eugene area, or they're just simply out of network with University Health Services, then all students have the option to purchase the University Student Health Benefits Plan. It's a medical and prescription drug coverage plan, and it's a pretty great plan. First, we started from a mindset of not-for-profit. So it's a self-funded plan that's fully funded by the university. All the money for the plan goes back into the plan. So we're able to offer such a great program for relatively lower costs than what you could find on the exchange. It's not nothing, so you still want to do your due diligence, but it is a medical and prescription drug coverage plan. It is a true PPO style plan, which means it does have that nationally available WRAP network. And it also includes automatically the global coverage that Deb alluded to, because we know these students don't stay put. They're here, they're there, they're everywhere. And we wanted to make sure that the plan that we were offering to them would work wherever they are. And so if you want to kick the plan's tires, you can absolutely go to our website and click through to Pacific Source. That's the TPA that manages the plan on our behalf, and use the Find Provider functionality to see if your existing healthcare providers are already in network with the plan. In theory, most of them should be. Of course, the plan has that nationally available WRAP network. It doesn't mean everybody's in network, but it should be the majority of your experience. And that way you would know ahead of time what it's going to look like with any existing care providers that you have. And I want to just pause and make a point, because it's a point of confusion that oftentimes we want to explain to families and students. When you're looking at the summary of benefits, you'll see 4 columns. And when you and I are talking about health insurance, we're used to seeing 2 columns, in network or out of network. And so what are those other 2? Do you have to make a choice? Is it a tiered program? No, that's actually just a reflection of how we layered in extra benefits for students on the plan. So we took that standard national WRAP network that we call our Voyager network, and we added to that. So in the Eugene Springfield area, if they happen to need care that's off campus, we have direct contracts with our major hospital, ambulance providers, orthopedic surgeons, over 100 mental health providers and other specialists, to just reduce their cost sharing a little bit more than that standard network would already provide. And then furthermore, at University Health Services, we wanted to be able to sort of push the easy button for students. So when we're talking about medical services, we waived the deductible and copay. So as long as it's a covered benefit and it's medically necessary, that deductible, copay, and cost sharing would all be waived. Our pharmacy has similarly low cost, but it's not a full waiver of the deductibles and copay. But you can see all of that on our website under the plan summary. Again, under that main website, health.uoregon.edu, and then just click through on the insurance tabs to both find resources to get to the root of the questions that Deb was alluding to, and then also really explore the plan coverage under the plan summary. Or there's 100 pages of the full plan document if you're really excited about it and want some exciting bedtime reading.
Yes, insurance, and we all love, it's such a sexy topic. I want to get to a question that kind of follows the insurance question. A specific, like, do you accept this plan? And I just want to underscore that your advice at this point is to make sure that folks call their plan provider and to know whether or not that our health center is in their network. Is that the advice that you're offering or that you're recommending?
Yeah, that's exactly right. Because to further Deb's explanation, like, let's say we're talking about the Blue Cross Blue Shield plans. We are in network with Blue Cross and Blue Shield, but there are thousands of Blue Cross plans out there, and many of them might be limited PPO, HMO, or other limited EPO style plans that might work really well in your home area, but then don't work at all beyond that emergency coverage once you leave your home area. And so we can tell you that we're in network with Blue Cross and Blue Shield, but it will not give you the information you need to make an informed decision. You need to know if your plan works in the Eugene Springfield area and specifically at University Health Services. That's why you want to call them and say, my student is going to be in Eugene, Oregon, Are you in network with University Health Services? What about Quest Diagnostics, which is our reference lab? How about Peace Health, which is one of the two major hospitals here in the area? It happens to be the one that's very close to campus, so students might go there if they needed an emergency service. Or Nova Urgent Care, again, they're really close to campus. So check on some of those major healthcare providers in the area. If your student also has known medical needs with specialty care, you could check on those types of providers as well. But you need to ask about your specific plan for your student in this area.
Perfect, thank you. Okay, so I want to get to some specific services, particularly around pharmacy. You mentioned pharmacy. So there was a question, is there a pharmacy on campus? The answer is yes. And I think a lot of families often have a question, and there is one from one of our anonymous attendees around ADHD medication, and if there's a particular requirement, or can you kind of talk through that in particular, but also what would a student who is on a medication on a regular basis, what would they need to do to transfer that prescription? How does that work for a student? How does the University Health Services care for that particular student's medication needs?
So I'll start off a little bit, and then you all are fortunate because Shannon is the director of our pharmacy. So I'll turn the general pharmacy question over to her. But in particular with ADHD, or I would say a student with any kind of specific medical problem, not just specifically ADHD, you should reach out to our office now in the next weeks to discuss, have your students' care discussed with one of our registered nurses, or if needed, we can include one of our physicians, but have that discussion ahead of time so we're fully prepared. It's going to vary. The answer is going to vary depending on the student's condition, what kind of medications they need, and how often they need their medications refilled. So it's really important that when we deal with students with very specific medical conditions, that we have those personal conversations so we can better understand it. We do limit our prescribing of ADHD medication, but that doesn't mean that I want to say we can't do it. I want you to engage with us so we can better understand your student's condition. And likewise with all of the rest of students who might have other medical conditions, we're happy to have those discussions, and we encourage them before your student gets here. It's really important for us to be prepared to take care of them. And it's better to do that before you come than the day that they're having a need. If they need a prescription refill, or they get sick, or they're having a crisis. So let's have that conversation and be prepared. So Shannon, I'll throw it at you and let you talk a little bit about the general pharmacy services and transferring prescriptions.
Yeah, absolutely. So we are excited to be able to offer a full suite of pharmacy services within University Health Services. And just like you would check with your insurance around the medical side, you want to check with them about our pharmacy as well to see if we're in network. We do bill all the major network plans. And on our website, pharmacy.uoregon.edu, there is a button that you can push that is to request a prescription transfer, and it'll bring you to a form that you can fill out to trigger that transfer of that prescription to our pharmacy. Or you can call your home pharmacy and ask them to initiate a transfer, or you can reach out to your provider who gave you the prescription and ask them to send it to us as well. And all of those options and the process to do that are also outlined on our website. So that's a great resource. And just like Deb said, I want to echo her sentiment to really take care of those things in a timely manner so you don't have any delays in care, and your student has minimal wait times to get those prescriptions transferred and filled.
Perfect, thank you. Mariko, I think there's some in your area as well in here. There are also some that cross areas because of the relationship between psychiatry and counseling at the U of O. I think it's worth spending a little time in this realm as well. So one parent is asking, if your child currently sees a psychiatrist for anxiety and depression, what information or documentation do you need from that doctor at the University Health Services? So that's one. And then some questions around how do students get connected with mental health folks? What kind of services do we provide? There's a couple others in here. I'll go ahead. Let's start with those two, particularly as they relate to the relationship around psychiatry and counseling and the services more generally. So I don't know if Deb, or if you want to handle the psychiatrist part, or if Mariko, you want to handle it all, I'll let you all decide.
How about I start with our general services at university or counseling services, and then I hope to encapsulate some pieces with psychiatry in there. And then if Deb needs to help me out with a little bit, please come on in. So at counseling services, we want to make sure you also know, this is something that Deb mentioned earlier, there are no additional costs when you're seeking services or resources at counseling services. You're already paying for it through the health fee. So no out-of-pocket costs. There's no reason to use your insurance when you're coming and seeking counseling services. And so just to start, some of the services we provide includes individual therapy. It is short-term therapy, so more or less it's about a term's worth of therapy. We don't want to focus on a number, but uniquely what is the concern that the student is bringing to us so we can address that. And just know we're all generalists, so we see the wide variety of different concerns students come in with: anxiety, depression, substance use, eating and body image concerns, identity-related concerns. So anything that your student would be coming in, we are all specialists with college mental health. I also want to mention we have a very strong group therapy program. So oftentimes the groups can look like creating healthy relationships. Those are often for students that are socially self-conscious or socially anxious. We also have groups for students that are grieving loss, so grief and loss group. We have one for survivors of interpersonal violence and sexual assault. And we have a variety of different groups, especially based for marginalized identities, so they can talk about their similar concerns and how they navigate college. I also want to mention we have weekly wellness workshops that are at the Duck Nest at the Wellness Center in the EMU, so our union. And so usually we'll have a stress and anxiety management workshop that happens every week, and then rotating topic. Some typical ones you can imagine when we start the term is just how to adjust to college, or having reentry anxiety coming back to campus, especially in this pandemic environment. I also want to mention there are a fair amount of students that are pretty therapy savvy as they come to counseling services or come to campus. And so when we know that they may be looking for longer term sort of support, then we would likely give them a referral out into the community. We have over 200 therapists in our community referral database. And so what we would want those students to do is just come to counseling services, have a discussion with us. We'll figure out what insurance that they use, and then what the concerns are and what specialty areas they may be looking for in the community. And we have case managers that will connect them over to those community referrals. We also do work very closely with psychiatrists on our University Health Services staff. So just know, certainly if we have a student that comes to see us and they're wanting some medication, we'll refer them down to psychiatry and talk with them about the various concerns that are coming up. And what I will say is that to that question of, what kind of information would be needed based on the therapist that they worked with in the past or psychiatrists currently that they're working with, it really depends on the provider and what information that they're wanting. So if a student wants to initiate sharing that information, then we'll get a release of information for whatever that provider that your student is currently seeing, whether psychiatrist or therapist back home. I also want to mention we have our after-hours support and crisis line. So it's basically our general number. So when our center is closed, your student can call that number if they're having a panic attack, or maybe they're having suicidal ideation. It's actually a number that you all can call just to consult if you're concerned about a student. And so to lead into that, I do want to mention you all can consult with us at counseling services. So if you're ever concerned about your student, how do I have a conversation about their mental health? How do I have a conversation about maybe they need to get connected to counseling services? Just know you call our center, and then we'll get you connected with one of our staff, and we'll talk you through that conversation. And last but not least, I do want to share with you the Let's Talk program. So that's basically, let's say pre-pandemic, if we're back in person, and that's the hope in the fall, we're going to have our specialists and our therapists out in satellite offices where a student can come in, check in about how they're doing. It also can be a way of, checking out what does it look like to have therapy. So it's an informal way to have one-on-one conversations with a therapist, and especially for students where maybe that's stigmatized to come to see a mental health therapist. Like I said, it's just a way to check it out. And it's oftentimes staffed by our mental health specialists, including our African-American Black student specialists, our Latinx student specialists, our international student specialists, and somebody like myself as well. And I do want to say over the summer, sorry, this is a long list, but I want to make sure I get all of this. If you go to our website and you look under therapy and services and you look at Let's Talk, right now we're doing Let's Talk Online. You simply click on a Zoom link. Right now, even you as a parent can click on that link if you want to talk to one of us to understand how does counseling services work or how to give support to your student. So just know that's a service for you. And how to access our services for your students when they come back in the fall is just say they can call, they can come in and schedule that same day appointment. We'll have a discussion. We'll figure out services and resources. And now I'll zip it shut. So
I'll say before Deb jumps in, Oftentimes, professional staff on campus also refer students to the counseling center or counseling services. I have walked students across the street. I know that resident assistants and community directors, when we see a student who needs more assistance or potentially therapy than we can provide, that we have the skills for, we often will help a student get there as well. So sorry, Deb, I interrupted you.
No, I was just amazed that Mariko got through all that. Good job. So no, I thought it was a good time to mention a couple of things that I thought about, they relate to what she was talking about. The psychiatry department is a department with physicians who do medical management for, for mental health concerns. That is by appointment, and that particular service does have charges related to that. That's not part of the health fee, and it's not part of the free counseling sessions that you get in Mariko's area. So I just wanted to point out that nuance and that difference there. And likewise, we'll bill for that insurance, bill for those services to insurance. And then I want to add one other thing. When we talk about medical records, if they're medical records that we feel we need or that you feel you'd like to share with us, on the medical side, we do have a patient portal that can be used. There's also forms on there, and I know that counseling has these as well. So if we need to pass information back and forth, we are considered a HIPAA compliant facility. And so we have to follow all of the HIPAA laws and regulations about providing medical records back and forth. So there are consents that do need to be signed, and those forms are readily available on our websites. So just to make mention of that. And then I want to make one last point that I think is really important for parents to know. University health services on college campuses exist for a reason. As you know, you heard Mariko, Shannon, and I, we've all done this for a lot of years, and we have done this. It's our career and it's our specialty. And the reason we have University health services at the University of Oregon is so that your student can come in and get care that's relevant to them and their needs. College is a time of transition. Even when you're in graduate school, it's different than when you're an adult and you're working 9 to 5 every day. So we are used to those nuances in this time of particularly a young person's development all the way through their time at the University of Oregon. That is our specialty, and we have a wealth of information among all our clinicians and many, many specialists actually. So we have specialists that a lot of university health services don't have, and we're really proud of that. So we are very deep and strong in our knowledge and our services, and I would just encourage you to have your student access us. If we can help them, we want to help them because this is our specialty, and they'll get really good care and specific to their need and their time and their development. So.
Perfect. Thank you. So we do have a lot of insurance related questions. I'm going to table some of those for now, and we'll deal with those in chunks, but there are some questions that are coming in around some more services, but also how does the University Health Services work with particular issues? So how does UHS or what do they do with a COVID positive person? That's one. How do you deal with an emergency? Is there transportation to the local hospital provided by UHS? These are all things that, like, how do you deal with this thing that I kind of want to have you all address? Can Deb, maybe you can start with some of that, and if Shannon, you want to fill in on some of those things too, I'd love to hear whatever you have to add to.
Sure. So the University Health Services does have we have urgent care available from our providers and their base of knowledge. We are not considered an urgent care center, but we are certainly there for the students. They can walk in for same day care. We have a brand new acute care area open that's meant for this very specific purpose, so people can get care for being ill or injured same day. If there was a true emergency, we are perfectly capable of working with that emergency on the spot. We would not care for that emergency long term. If it was a true emergency, we would work to stabilize a person, call an ambulance, and have that ambulance take the person to a hospital. There are three actually hospitals nearby. The one is very close. They do have emergency room care at the one within a mile of our facility. There's another hospital called River Bend that does a surgery, and they have a lot more services available for medical conditions. And then there's a Mackenzie Willamette Hospital that's also in Springfield. So there's a lot of emergency care close by, and we would transport via an ambulance. Students who need hospital care but maybe don't need an emergency room, we certainly work with them one-on-one to get them the appropriate transport to that hospital if they need further care than what we can manage. Our acute care has a really nice offering. We actually have kind of, we call them like patient care bays, and they're big rooms where students can hang out if they need some IV fluids or they need some medication and they need to be monitored. We have nurses and doctors right there. It looks, quite frankly, like an urgent care that you walk into. So we have the ability to treat a lot on site, but if it is beyond what we should be doing for them and they need additional services, we'll certainly get them to the correct place.
Thank you.
I feel like I missed part of it. I feel like I missed part of the question though.
The one that did you answer the COVID? Like what happened?
Oh, COVID. Yeah. So that's, I knew I was missing something. So
It's all right.
right now, so in the fall and in the spring, when COVID was very, we were being very cautious, we implemented a lot of different ways that students could access our care. We had a call first campaign. So if a student was ill, they called us first and we got them to the proper entrance. We segregated those who had respiratory viruses from non-respiratory illnesses and or emergencies and care that was needed. So we did have separation of services. Over the summer, we don't do that right now because our census is low and we don't need to do that. We have screening at the front door, and if somebody screens positive for anything that is suspicious of COVID-19, we would certainly take them into an area away from others who are there for other reasons and keep them separate until we diagnose them to see if they have COVID or not. So there is definitely a separation of care, and we take that very seriously. We do screening. Our facility does continue to do social distancing and masking, and that is part of our regulation under Oregon Health Authority, but also because we feel it's the right thing to do. So we definitely segregate them. We take care of them, and if they do need isolation because they have COVID, we will help. Either if they're residential life student, our care team will help get them settled in an isolation room, and we'll make sure that they have meals and all the resources they need. If they're off campus, we'll work with that student individually to make sure that their needs are taken care of. So that is very specific to COVID-19.
Thank you. I just recall, like, in the last academic year, how many times I heard the name Dr. Anna.
Yeah.
And Dr. Brunader for sure too. But Dr. Anna came up a lot from students and their families when, if they had questions and didn't know who else to talk to, they said, there's this Dr. Anna. And it was wonderful to, hear folks talk about how great she is. There are some questions around personnel at University Health Services. So one question in particular is about professionals. Are there RNs, physician's assistants, real doctors, I think is in the question. And so I want to make sure that we talk about who are the professionals in University Health Services. And then another question that came up is around, can a student request a specific doctor of a specific gender? So I think that's one that we tend to get, especially from our female identified students. So I'd love to hear about the staff and who serves the students inside University Health Services and about requesting specific care providers.
Sure, I'd love to talk about that. We actually are very proud. We are a nationally accredited center for medical and mental health care through the HHC. And so we're proud of that designation, and that designates us as somebody who's fully licensed and accredited and has a piece of quality that is really proud, we can be really proud of. And our physicians and nurse practitioners are all fully licensed through the state of Oregon. We have fully registered or fully licensed registered nurses. We have a licensed practical nurse. We have some medical assistants. In Shannon's area, all of our pharmacy staff are fully licensed. We have licensed physical therapists on hand. In Maricos area, likewise, we're all duly licensed through the state of Oregon. So we are a really robust and proud facility, and we offer services, I want to say, above and beyond other places in the Eugene area, but we are very equivalent to the kind of care that you're used to in your own home community centers where you see your doctors and nurses. So we are fully licensed. We carry all the obligations of such. We carry continuing medical education is important to us. And so I think we got you covered.
And I'll chime in that you can actually learn a lot about our individual healthcare providers on our website. There is an Our Team link where you can click through and meet the members of our team, including seeing their professional bios for the ones that have them. That's most of our professional staff have the professional bios. And so if you have a specific medical condition or concern that you want to sort of try to find a good match for yourself, you're welcome to do that. We do encourage students to establish care with a provider and then maintain that continuity of care. We know that not all students choose that. Some just want to see whoever is available first. But for those that are interested in that continuity of care, we certainly encourage that. And in terms of requesting a provider of a specific gender, yes, absolutely, that's possible. And we do our best to honor those requests. We have a pretty deep medical staff, so that is typically something we're able to do with ease.
I would say, yes, I agree with that. And we encourage that actually. And you'll see in our bios that a lot of our specialty areas and a lot of our areas of interest are in our bios, so you can find a good fit. And I think Marika would say that on the counseling end too. The one time that if somebody has an urgent need, they may not be able to ask for a specific person depending on our staffing, but we have like Shannon said, it's a deep staff. And so we should be able to accommodate all the requests with the exception of an urgent issue. So, yeah.
Right. And Mariko, can a student, if they connect with a particular staff psychologist, can they continue to request that person as they need, or as they're able to continue to come in? Or
certainly, if they've already had one course of therapy, say their freshman year, but they come in another time in their time at UO, they can request for that same therapist again. And I do want to share, just even beyond gender, they can ask for, oftentimes I'll have students who ask about race, ethnicity. I'd like to see a person of color or a BIPOC therapist. And certainly we want to, give the student what they would feel most comfortable in sharing their personal information with. So
thank you. Okay, we're going to shift gears just a little bit more again and cover privacy. So we had some questions around FERPA, which several family members are familiar with, either because they've been part of these before, they came to introduction where we talked about it a little bit, but also HIPAA is something that is an important concern for you all to work through as well. So can you talk a little bit about waivers, permissions, slips, all the things, and particularly around how often, when, like blanket waiver, we get all those questions. You all get them. So I'll toss it to whoever, but let's cover privacy, particularly around care.
Yeah, so I'll start and I'll ask Mariko and Shannon to add if I miss anything, but we take privacy extremely seriously. And, this might be the first time that your student accesses care without a parent, and that is scary for them and it's scary for you. I also do want to say that we are similar to Mariko and her words earlier. We do encourage students and families to talk if there is a student who has a need, and we encourage them to engage their family, but we also want to respect their privacy. And if they want to come in to see us for reasons they may not want a parent or a family to know about, we will respect that and we will not break that confidence, because we are required by law to be to cover the privacy under HIPAA. There is a difference between HIPAA and FERPA. So medical privacy, it goes under the HIPAA laws and regulations. The student educational privacy goes under FERPA, and we are a blend of those two. So there are certain circumstances where we can release a person's medical information under the FERPA laws, and we're dealing with one of those right now. So COVID-19 vaccine is an excellent example, because the university is requiring that. We have the ability to communicate whether a student's vaccinated or not, and we are doing that in a residential life area, because residential life has a contract for which they're abiding by and living by under the COVID-19 restrictions. And if they're not vaccinated, they'll have to go undergo testing. So that's an example of where we would share somebody's information for a very specific reason. Outside of that, we don't often share. And if we do have to share under FERPA, oftentimes we're making sure that that's a real, that there's a real need for that information to be shared. So I want to, it's really important that our students understand that they can come to us and get private advice and private care regarding their concern. And I always say this, I was a parent of 2 people who went to college, and I would rather have my child seek care and get the care they need and me not know about it than me being the barrier to them getting that care. And so I would encourage you as parents and families to think about it that way, and also entrust us that we have really good, knowledgeable providers. And if we do feel a person should involve their family or parent, we would encourage that. And we would have a conversation with them and ask them if we can do that. If you call us, we will tell you that we do need your student's permission to talk with you, and we would take that step. So I want to make sure that that's clear, and that would be a conversation. We would actually reach out to your student and have a conversation and get their permission for that. So I want to put that out there as not as a barrier to care, or not for you to be fearful of that, but to know that we really do this for your students' best interest, and by law we have to. And when we talk about this, we're talking about this for basically 18 years and older students. Minor students have a little bit different laws that we have to follow, but there are some nuances with minor care as well, where we don't, under Oregon law, have to release information to a parent. So under 17 or under 18, we would have to consult with why you are calling us to see if we would need to share that information freely or get your students' permission. So Mariko, I know there's some specific things for mental health. Would you like to address those?
I think in general, you would cover it as, so if a student is wanting to release information to you, we would just ask the student to sign or what we call a release of information form. And with that, they actually detail exactly what information they are wanting for us to exchange that information, because we don't want to share just like any detail that comes from their file or records. If they're wanting to know the diagnosis, or maybe they're wanting to know what resources or services we would recommend to the student, but we want to make sure that it's very much specific to what the student is agreeing to release.
And I would also say that we talked a little bit earlier about billing your health insurance company. And so if there was a balance due because there's a patient responsibility, this is another thing that you'll see come through the DuckWeb account. It'll be a de-identified charge. So it won't say a person was there for XYZ at the Student Health Services. So that's another piece. If you see a bill come through that you wonder about, you should consult with your student because we would need their permission to discuss that with you as well. So I just want to kind of add that out there, that's another layer of oftentimes parents call and say, well, what was this $20 for? And we can't tell you freely why that $20 is on that bill. So we encourage you to have those conversations with your student.
Well, you all, I'm going to butt in here too, because I can, but you all are also in a position where you're assisting students, we're working with emerging adults, right? So they're developing, like, not only is this maybe the first time that they're accessing healthcare without a parent right there, but we're also trying to help them learn how to do that and be their, exercise their own agency and advocate for themselves and in those areas. What's the approach there? Like how do you work through that when you see a student who is clearly new to this and maybe a little bit afraid of making the wrong choice or not doing what their mom would do?
Right. It's a great question. And I think it goes back to us being experts in college health, because we realize that this may be the first time that they seek care, and it is an educational process. It's part of learning and part of growing up. And even though it's not maybe a legitimate class at the University of Oregon, it is a class. We help them through that. We help them understand how to make an appointment, how to seek care. And quite honestly, we call a one-door approach. So if somebody comes into our main lobby and just doesn't know where to go, we have a whole team. We have a greeter team there to help them get to the right place in the building. We have front desk people who are really used to students not understanding how to make an appointment online maybe, or why it's it's important that we have a copy of their insurance card, and we help them to understand the forms they're signing. Oftentimes they'll sign them on the portal ahead of time, but sometimes we'll have them sign forms while they're there. So we are free to have those discussions with them and help them understand the process. And we really look at this as a class in health education and how to help them grow into adulthood with additional skills when they leave the University of Oregon. So we have a team fully prepared to help them through the process. They will not be a number. They will not flounder through the building. We really do. We love our greeters. Our greeters are their peers. They stand down there and they say hello to everybody that comes through the door, and they make sure that they add that personal touch and get them to the right place. Mariko?
Yeah, but if I can just add, because I want to be inclusive of the fact that there may be some students that are a little bit fearful or more anxious about making those appointments. And so I just want to share that I've had experiences where a parent will come or a family member will be visiting in town, will bring their student to health services and to bring them up to counseling services to the lobby to schedule that appointment, or maybe make that phone call together. So, if you can point the student in that direction, I don't want to enable, the student to not be able to do these things on their own, but certainly if they need a little bit of a nudge and a little bit of guidance, I want to make sure that we have seen that happen, and that it's okay to do to get them to be that independent adult. So.
Thank you.
Absolutely.
So I'm going to blanket this one because we have a lot of folks who are asking, can family members provide information to you? There was one in particular around sharing a student's type 1 diabetes records with health services, and that done previously with school in the past, but also lots of families who are wondering, can I call you if I have a concern? Can I share information with you? Can you all address that kind of general question?
I'll take it first, and then I'll let Mariko finish, because this is a really important thing. We are free to take information from you at any time. If you are concerned, let us know. We can't make a student come in to see us, but we certainly have a lot of ways that we can reach out to students and encourage them to get help if you feel like there is a concern. So as far as a medical record, you can certainly submit a medical record freely to us. Anything we take in is fine, as we can't give freely without the student permission. So I would encourage you to work with us and get their medical records. Anything that we can put in our medical record on the medical side anyway, that will help our providers there provide better care for your student, or understand their history better, or maybe a medication you've tried in the past that didn't work and it's well documented. So we know that ahead of time and we can work with that student. That is all really valuable to us and to your student and to the experience they have and the expediency with which we can provide their care. So I would encourage that. Likewise, as I said before, if you have a specific concern like a type 1 diabetic, call us and we'll put you in touch with Dr. Mary Allison Smith. She's our specialist for diabetes, and she can have a conversation with you and better understand your student's experience in the past. So we encourage it on the medical end. I know mental health will as well, and I'll let Mariko speak to that.
Yes, I've certainly spoken with a variety of faculty, staff, peers, and parents when we find that students are underreporting their mental health concerns. So it could be that they have more severity that is manifesting in a way that you're observing, but perhaps they didn't report that to us. And then we may make a decision of something that didn't seem to be the appropriate care and resources. So certainly we want to welcome whatever information you feel that they are not completely telling us, you can share with us. But as Deb had mentioned, we cannot share with you or confirm attendance for our services or whatever discussion we had with the student. But what I will say is that we take that information very seriously. And when a student does see us, we will do that take that background information and reach out to the student and contact the student to make sure they're getting the appropriate resources for whatever the concerns may be.
Thank you. So questions about power of attorney, medical directives. I know we kind of loosely talked about privacy, and then as soon as we did that, we got the power of attorney questions. Who wants to handle those kinds of questions?
Well, I can start. So I've done this for a long time, and we're very happy to put your healthcare directive or your power of attorney on file in a medical record. However, I would encourage you that you prepare your student with that somewhere else as well, because we are not there at 9 o'clock at night. We are not there at 2 a.m. We are not there on Sundays, those and holidays. So you never know when an emergency might happen. So we're happy to take it and have it on file. Quite often when we have things like that, we would of course only rely on them if your student was not able to make a decision for themselves. But likewise, I would encourage you to prepare your student to have a copy in their room, maybe have a roommate or a residential advisor know where that is. So if there's a cause for the need for that in the middle of the night or sometime when we're not there, it is readily accessible. So I have really strong feelings about that. I've done this for a long time and I've seen these things come up. So I think that's the best advice I can give you on that one.
Thank you. Okay, so I want to, we've got some service related questions too that I want to get back to. I was going to do it in a different order, but I just saw a question that I really want to get to first, because I think it actually is one for both sides of University Health Services. Is there a nutritionist or eating disorder specialist among the staff?
I can start. We have a team of medical providers who do work with students with eating disorders. On the medical end, we will assure their physical well-being, we'll take their blood tests, we'll medically manage their care. We do have partners in the community to help us with students with eating disorders. So if it rises to a level above what we can handle internally, we would engage those community partners. We do not have a nutritionist on staff at the University Health Services right now. It is not something, it may be something we solve over the year, it may not be, but currently we do not have a nutritionist, but we do have people in our community that we can freely reach out to. One of the things I've been working with our medical and mental health providers is there is a pretty good, and Mariko can probably talk about this better than I can, but there's a really good rapport between our medical providers and our mental health providers when we're treating the same patient and with the same student with the same condition. And so there's a lot of information going back and forth so we can really provide comprehensive care for that student. And so I'll let Mariko jump in there, but we certainly have the ability to treat eating disorders to a degree, but if they needed any kind of, if the patient needed any kind of really intensive care or any kind of, even outpatient type care that needs frequent check-ins, like maybe being there a few hours a day for therapy or something like that, we would engage a partner in the community.
I will say Deb covered most of it. So just to reiterate, we do have specialists on our staff that address body image and eating disorders. I also want to share, we typically have a therapy group called Mood, Food, and You. So certainly for students that are wanting a healthier relationship with food. We also through the DUCNEST have something called Body Love Society, which is a peer-led support group related to body image concerns. So just some services to make sure you knew about.
Thank you all. I want to go back to one of the other service related questions that I'm seeing a lot of in the Q&A around dental services, particularly do we have them? What if there's a dental emergency? And then insurance related questions around dental coverage. So I think Shannon, you probably get to answer most of those, right?
Yeah, once again, you're fortunate. She directs our dental services. So
Yeah, so we do have a full suite of dental services available in University Health Services. It's beautiful, frankly. It's up on the third floor, floor to ceiling glass, looking out over Oregon Hall. I mean, it's just a beautiful state-of-the-art facility. So we offer both routine dentistry and some advanced dentistry to try to keep students on campus as much as possible. And again, if you're interested in learning more about our dental team, you can click through that to those links and see their bios and who they are. Our dental clinic is in network with most major dental plans, but it's the same thing as the previous directive. As it pertains to your dental coverage, you'll want to check with your plan to see if they're in network with University Dental Services. And then we do offer emergency dental care so that if, for example, a student, and oftentimes they're coming from our medical services because that's where sometimes the student ends up first. So we'll get a call from one of our physicians saying, we have a dental emergency downstairs, and we will do a warm transfer up to the third floor, get them stabilized, and provide that initial care. And then just like for things that are above and beyond the scope of what our dental team is going to provide, like we were talking about in other areas. We work with a network of dental providers and oral surgeons in the community. If something was needed to be done on a higher level, we'll do a warm transfer, records transfers, et cetera, to help make that smooth for them.
Perfect. Okay, so we're going to dive back into insurance, Shannon, and Deb fill in, obviously. There's a number of questions around insurance. One in particular was around this, actually there were two with regard to the student health plan that you all have available. About the coverage, is it available during the breaks?
Yeah.
So I think it probably needs some clarification on the coverage period, right? And then there was some questions about whether or not the one that they're seeing on the website is the only plan that's available. Can you cover those?
Yeah, absolutely. So the plan is a federally certified ACA compliant plan. It's medical and prescription drug coverage. It does include the pediatric, dental, and vision, but most students are going to age out of that very quickly. So for your focus, it's a medical and prescription drug coverage plan. And because it's a federally certified plan under the Affordable Care Act, it's going to include all of those essential health benefits that are required by federal law. And every single year, the plan gets certified as such through CMS. So it's a great plan in that respect. It is because it's a federally certified plan, it's also operating much like any other plan that you're accustomed to. It's got an annual coverage period. The only difference is that because we're an academic institution, rather than going from January 1 to December 31, it mirrors an academic schedule. So the coverage is going to begin on September 15th. And then always follow to the following September 14th. And as long as your student stays active and enrolled in the University of Oregon as an eligible for the plan, they will be on the plan for that entire year. And just like you or I can't make mid-year adjustments without a qualifying event, those same rules apply to the student plan. So we ask our families to please pay attention now to taking advantage of that open enrollment window, because we do not allow voluntary mid-year enrollment, nor do we allow voluntary mid-year terminations. And so you really want to treat it just like you would your employer-based plan, where you have a finite time to enroll, and then you're making a decision for that entire plan year. So again, from September 15th to the following September 14th. This year, we are already in open enrollment. So it begins each year on August 1st. And this year for our non-law students, it ends on October 6th at 5 p.m. Pacific time. You're all going to get a couple of postcards, a letter in the mail, some email reminders. There'll be messaging on campus, but it's really helpful if you can put some calendar alerts in for yourself so that you don't miss that deadline. If you intend to enroll, it is a firm deadline. There are no exceptions beyond, again, those qualifying mid-year enrollments with a qualifying event as determined by federal rules. And then in terms of choices, we offer the one plan. And so there's no tiered coverage available. Some universities that have an insurance requirement might offer like a supplemental plan, but we do not have a requirement here. So we're not going to automatically enroll your student in the plan, but it is just the one plan that they're choosing to purchase or not. So yeah, take a good look at it. You can find all that information on our website, and definitely call us or email us if you have questions. Our email is uostudentinsure@uoregon.edu.
That's a lot. That is a mouthful. Questions are coming into or have come in around what services are available to students who don't have the U of O's plan. I think this is another good place to clarify what the student health fee covers and provides, and what an enrolled student can access at University Health Services.
There we go. Sorry, the mute button got me.
It's okay.
Yeah, so the UO student health fee, it covers the behavioral health, mental health counseling services, our after hours, our outreach services, our duck nest offering, basically all the peer health education that we do. It offers a few select services at the University Health Services itself, but most medical services, lab services, radiology services, dental, pharmacy, physical therapy, those are all billable services that are not covered by the student health fee. Like I said earlier, it's a little bit complicated, but if you look at the three of us here from the health services, basically the area that Mariko is in, those services are covered by the health fee. Most of our other services are not and are billable by insurance. And it doesn't really matter. We'll bill any plan. So you don't have specific services available if you have the student plan over another plan. It's just how those services are paid for.
Perfect. Okay, so the beast that we always hear from every year is Kaiser. So there is, of course, a question about Kaiser in the Q&A, and what kind of coverage and what kind of services are available to students with Kaiser. Anyone want to field this one?
I can take it.
Go ahead.
So Kaiser, as those of you that are on Kaiser know, it works really well when you're in a Kaiser network. But as soon as you go out of that Kaiser network, it does not work. You know, it's an HMO style plan. It just happens to be a really large, robust HMO style plan. And so Kaiser does not have a strong footprint here in the Eugene Springfield area. So we very strongly encourage our Kaiser families to take a look at the student health benefits plan, either as an alternative or to add in to do both coverage. There is a smaller primary care clinic in North Eugene, and so you can check that out. I believe they have dental services, but not much beyond that. The closest hub for Kaiser is Salem, Oregon, which is an hour and a half drive from here. So you just want to take a real deep look at it if you're on Kaiser. And then the other thing that I'll say is for those of you that are going to keep your Kaiser coverage that are coming from out of state or out of area, you definitely want to call your Kaiser home plan and let them know that your student's going to be in Eugene, Oregon, because for some of those plans, like in Southern California or Colorado, you're going to want to switch them to Oregon Kaiser so that even the Kaiser works up here. But again, it's a pretty small footprint here in the Eugene Springfield area. So I'd encourage you, look at what that looks like, consider how your student might access care there, the scope of services that they have there, and take a real hard look at the student health benefits plan so that they can also access care on campus and wherever else their studies might take them. Because again, back to that first sentiment that Deb noted is that our students, they are moving. And so if they're doing an internship in New York City, if they're going internationally for spring break, you're going to want to make sure that you have coverage that follows them wherever they do. And so that's another reason to really look at that student health benefits plan and consider the double coverage is the best coverage if you can keep them on your existing plan and layer in the student plan as a secondary. But certainly we have some families that will drop them from their family plan and add them to just the student plan. Just take a hard look at it. That's our best and strongest encouragement.
Thank you for that. I know that that's one that we get all the time, especially up and down, I-5 corridor, because we've got a lot of Kaiser families that come, they sort of are like in the middle of a sandwich. So thank you for that. Okay, so a couple other questions around services, particularly around the pharmacy again. Can the pharmacy dispense birth control pills?
You know, I'm really glad this question came up because I was feeling badly that I didn't highlight their clinical services. So here in the state of Oregon, we're actually really fortunate that they have the ability to do advanced clinical services as licensed pharmacists, and we take full advantage of that. So they do have a contraceptive care program. They also do tobacco cessation, and they can also do vaccine administration. And there's some other things as well that are a little bit more granular, but they do have a full suite of clinical services available. And we encourage you to take a look at that. For a lot of students, they're like, I don't want to see a doctor to get my birth control managed. I'm just going to see the pharmacist, and that's fine. Either or. Absolutely, we're here to meet that need.
Thank you. One more on prescriptions, and then we'll move to some other, like sort of a potpourri of questions. On the same line of prescriptions, if a student has a doctor in another state and has an ongoing medication they take, can a prescription be transferred to Oregon under a California doctor's license, or does the student need an Oregon doctor to write the prescription?
Yeah, we do accept prescriptions from out of state, and unless the specific medication within that prescription has some sort of additional rule, we will be able to honor that. So the first thing to do is to look again on our website, pharmacy.uoregon.edu. for how to transfer that prescription to University Health Services, check with your insurance to make sure it's in network or enroll in the student plan, and then get that prescription transferred over to us. And if there is some sort of limitation on it, we will reach out to let them know that and work with them to get that placed with another provider, but we do accept cross-state prescriptions.
Thank you. Okay, so another one that I really have enjoyed looking at as I scroll through these up and down. Do you offer preventative and or alternative health practitioners?
Yes, to both, really. Another area of, on the preventative end, we have a variety of preventative services, and we in fact encourage students. And this is one of my biggest points to make to students and families right now. During COVID-19, a lot of preventative care did not happen. And so I really encourage your students to reach out and get the care that they need and have their wellness exams done, check their immunizations, all of that. A lot of times, you know, many times over the past 18 months, those things just didn't happen for safety reasons and other reasons. So yes, we offer them and we encourage it. And then on Shannon's end, again, you're lucky because she directs some ancillary services that has some alternative care in some ways, I guess, if you want to talk about acupuncture, massage therapy.
Yeah, so within our physical therapy services department, we do have licensed massage therapists and acupuncturists available. And so we encourage you to take a look at that. You can also find their information and bios on our website. And then in terms of other prevention, we have an STI wellness and sexual health well-being clinic to help keep students preventatively safe there, and including screening tests. We do have an on-site CLIA certified high complexity laboratory so that students that want to be doing routine checks can do that right through University Health Services. And we encourage them to take advantage of that as well. And then in terms of our contraceptive program, they can access free supplies through University Health Services and through several hubs around campus, and then also through our Protection Connection if they need to have something delivered to their mailbox in their dorm room.
Perfect. Okay, so a couple questions around vaccines, vaccinations, both which ones do we provide? So one in particular was, do we offer the flu vaccine, which I know Deb is going to love. And then also around whether or not we recommend the meningitis B vaccine for a student living in the residence halls.
I can answer those. Yes, get your flu vaccine. And yes, we will have flu vaccine for your students. So generally flu vaccine lands sometime in October, and we'll be watching those times, and we will make sure that students, it's announced broadly through our digital displays throughout campus and through our website when flu vaccine is available and how it can be accessed at the University Health Services. So yes to that answer. On the meningitis front, there is a required meningitis vaccine, but then there's also the meningitis B vaccine. And the meningitis B vaccine in the state of Oregon is recommended. And what I recommend you do is to talk to your doctor. We highly recommend both of them. And I, as a parent, would encourage both of them, but I do want to honor you and your doctor's relationship and have a conversation about that meningitis B vaccine. There are also on our health.uoregon.edu under immunizations, there's a list of the required vaccines, which is the measles, mumps, and rubella, chickenpox, the quadrivalent meningitis vaccine, and a TB questionnaire. But there are also some recommended vaccines, and one of them's the HPV, one of them's meningitis B, and the others are hepatitis A and B. So I recommend anything that's on the recommended list, you have a discussion with your doctor. A lot of times students already come to the University of Oregon with those recommended vaccines. Most doctors in the US prefer they're fully vaccinated with all of those. So just have that conversation with your doctor before they come.
And we do offer most of the vaccines in-house, either through our medical services or through our pharmacy. So if your student happens to arrive on campus and hasn't already gotten their flu shot, we will, as Deb mentioned, have that. And others, like if they're traveling to a specific country and need a list of vaccines for that country, we can oftentimes provide those as well.
Thank you for that. So the one of the other questions come up a couple of times is around notifying close contacts when a COVID cases come up in a particular residence hall. I think this is a great time to talk about the contact tracing and the Corona Core team. I don't know if you're still calling it that, Deb,
Yeah.
but how do students who are a close contact, and particularly in the residence hall living situation, how are they notified? How quickly does that happen? What's the protocol there?
So there's two types of testing a student might have. They might have a test through the University Health Services, and that would be because they either have a concern, a need for a test, or they might be ill and need to have a clinical diagnosis. There's also the University of Oregon has, they call it UOMAP testing, and it is set up to do surveillance testing. So they could get tested one of two ways. And either way, the student will directly be contacted with the test result. And at the same time, if there's a positive test result, there is a process for contact tracing. And we were really fortunate at the University of Oregon last fall to be able to partner with our Lane County Public Health Department and set up a team of students who are highly trained to do the contact tracing. And we call those our Corona Core team. And it's a team of students who have been engaged to do this with us. And they're all very, very passionate about it. They're trained very well. And then we also extended that to what we call the UO Care team. So many of these team members are the same. They cross over from Corona Core to Care team. So we really do take care of the contact tracing in the event somebody's positive. We call the person who's positive. We ask them where they've been. We've asked them their close contacts. And then that same team of people reaches out to those people who were potentially exposed and are considered contacts. And then we work with them through our UO Care team and through the Corona Core team to make sure that they isolate when appropriate and quarantine when appropriate, answer all of those questions they have. So we were really proud of the fact that we could set this up internally in-house, overseen by our medical director, Dr. Richard Brunader, Dr. Anna, who you've heard about, and then Angie Long, who's the director of our public health practices. They set up a really robust system, and our students are really well cared for. I believe that they're much more well cared for than the general public because we have all these resources and we spend a lot of time with students on the phone if they're a contact or if they're a positive case. So we can make sure that we get their questions answered. And then the same care team does follow up with all of these people to make sure if they were diagnosed with COVID or if they're a contact and they're concerned and they have to quarantine, we follow up with them to see how they're doing and kind of, you know, make sure that they're doing okay and don't have any resources that are unmet needs. So yes, that's our Corona Core team, and we're really thrilled that we have that. We sunsetted some of their activities, not all the way, over the summer because our need was not the same, and they are all remain engaged with us and ready to redeploy if needed this fall.
Thank you. We've had some questions come in around COVID records. One is, how do you know, or how does a student know that you have received their vaccination records? Is there a confirmation that it's been received and accepted? And then another one that seems a little vague to me, so I'll just read it verbatim. My student was told that they had to have a signed letter or document from their doctor regarding the COVID test, but they received their COVID test at Walgreens and did not receive it through an MD. I'm sensing a little confusion on that one. Perhaps the signed letter from the doctor is around the exemption, but I could be wrong. So I'd love for you to address where a person needs a signed letter from a doctor and versus what kinds of tests are accepted as proof of a negative test result. So two things, like how are the vaccination records confirmed that we have them and they're acceptable? And then where do doctors' letters and documents come in with regard to testing?
So let me take care of that first. I think there's some confusion there. In the University of Oregon housing area, if a person's going to live on campus, if they choose not to be vaccinated, they are required to bring a negative COVID test within 72 hours of their arrival to check into their housing, to get their housing key. So that is the only time that we are requiring a negative test. It must be a EUA approved qPCR COVID test, and it must be negative within the 72 hours of arrival. There really is no doctor's signature there. The test result would say where they received the test, that it's an EUA approved test, and then the test result is negative. So we'll look at that 72-hour time stamp. As far as the exemptions go, there is no physician's signature required for a COVID-19 vaccine exemption. The process is such that the students will be asked to watch an educational module so they understand what the COVID-19 vaccine is, how it can protect them, and the steps that they may be asked to take in the event that they choose not to be vaccinated. Once they complete that module, they go on to their Medigap portal or to their MyUO Health portal, and they can complete an exemption form. Once again, there's no physician's requirement or signature for that. So that's an independent action on their part too. And then on their COVID-19 vaccine card, they're uploading a card that they received at the time that they got the vaccine. Most of us didn't go to our doctor's offices to get it, but wherever they got the gray card is what they need. And it will have all the information that we need on it, as well as the dates that they received the vaccine. We do a verification process on that. And if there is any concern about that verification process, our immunization coordinator would reach out to them personally, either through the portal or through a phone call or a text message, and let them know that there was an issue with their card. But as Shannon alluded to earlier, they can always go on to their student portal and see the status of that. And if there's any question about the status of their immunization card, they can email I believe you put the email in the chat earlier. They can email our immunization coordinator.
So one quick clarification that should have scrolled down farther. So the questioner mentioned that they were told that the vaccine needed to be signed, the vaccine record needed to be signed by a doctor, but they received their vaccine at Walgreens, not through an MD.
Right.
Is that is the signature just the provider or the location? Can you clarify that for our questioner?
Sure, it does not need to be signed by a doctor. It's whoever provided the vaccine. So on the card, it'll list the date, the location of the vaccine, and the lot number of the vaccine. And whoever signature is on that card is all we need. We don't need the physician's signature indicating that that's a valid card. So, and many of our students did not get a vaccine through a doctor, me included. I went to a vaccination clinic where a nurse or a paramedic or someone might have given it to me, but the card should be complete. And if it's not complete, we can work with you. If a person was immunized in Oregon, we have a way to verify that through an Oregon immunization system. So there's lots of ways to take care of that, but a doctor's signature is not required.
And if they're out of state and it's missing that signature, I would encourage you to go back to the provider that you got the vaccine from and just tell them like, hey, this is what happened. They should have the complete record and be able to help you remedy that if something got missed at the time they received that vaccine. But here in the state of Oregon, again, as Deb said, we can pull in from the Oregon Alert Immunization Registry and oftentimes help you repair that through us.
Perfect. So the question is, are we going to offer a COVID booster if it becomes recommended? Is that something that would be administered here on campus? How does that work typically?
Sure. So we're closely monitoring that right now, and we suspect that Pfizer, and as of today, Moderna will most likely recommend a booster. So we'll be monitoring that. Currently, because of the way the state distributed vaccine, we did not choose to get vaccine at the University Health Services because it was given through our mass vaccination clinics. That will change at the end of September. We will have vaccine on site, and we are yet determining whether it will be both at the pharmacy and in the clinical area. That's our hope, but some of this is determined by the state of Oregon right now. So, but either way, we will have vaccine at the University Health Services. And then we will work really closely with our environmental health and safety office, because they were the ones that set up the mass vaccination clinics to begin with. We did not at the University Health Service have the capacity to immunize large amounts of people. So we will work closely with the University of Oregon. And if boosters are recommended, it could very well be that we set up mass vaccination sites again versus people coming into the health services, or we might do it at the health services. So right now, that's a decision that will be made based upon the recommendation and the timing of that recommendation. And we will carefully update our website with this information, and we will also notify our students really carefully, either through digital displays, through our website, through communications with our communication experts at the University of Oregon, when and if that all is required. So yet to be determined, but it will be freely available for students while they're here.
Thank you. There's a couple big policy related questions I'm going to pass to you, Deb. And then just so you all know, there are still some very specific questions from some of you that because of their specificity, I'm going to forward these on to this group after this and have them email you back. So I have your email addresses and the questions. And so we'll try to get those answers to you without putting them on a broadcast or a recording. One question that came up around policy, can you address the mask mandate now? If the UA requires the vaccine, why the mask? In parentheses, not trying to sound ignorant, I want to understand, which it's a totally valid question, for vaccinated folks. Why are masks required indoors? Deb, do you want to speak to the university policy thinking and maybe the medical thinking around that requirement?
Sure, I'd be happy to. I actually sit in on the meetings that where these policies are discussed and how the decisions are made. And we were without a mask mandate for indoors. If a person was vaccinated, as of a week ago, that changed and they re-implemented masks in the indoor area at the University of Oregon. That continues to be discussed, whether we will follow the indoor mask mandate or whether we will follow CDC guidelines. But the thought is, according to the CDC guidelines, when an area goes into an area of high risk on the COVID, the map, right? The risk map of those getting COVID-19. As that risk goes up, areas will respond and they will implement indoor masks. And so that's what the University of Oregon did. We saw in our area, in the state of Oregon, our cases were going up. So the University of Oregon thought the safest thing to do would be to re-implement masks indoors. Right now, that's the policy. It will be discussed and it will be watched carefully according to the cases in our area and in Oregon. And it will be most likely, I think our plan is to react accordingly. All that being said, this is a very fluid situation and one we take very seriously. There are about 3 meetings a week right now following all of this and trying to make good decisions for the health and safety of our campus. And so as I say this today, it could be changing tonight and I don't know it. And that's just kind of the way COVID has gone for us over the last 18 months, as it has for all of you. Mm-hmm. So I would say follow our COVID-19 webpage very carefully for updates on the policy. We likewise at the University Health Center will also publish them. I will tell you that the University of Health Services was under a different mandate because we were a healthcare facility. Masks were required indoors even when they weren't in other places. So we might have separate policies depending upon how the state mandates certain areas of the university. But I do want to assure you, we take this very seriously. We're following it very carefully and we're basing all our decisions on science. We really do follow the CDC recommendations really, really closely. And that's what we did with this mask mandate. As cases went up, that was the CDC's recommendation. So we implemented that.
Thank you. Okay, so one more sort of policy-oriented question, and then we want to wrap up. But again, those very specific questions, I will forward to these wonderful colleagues. So one question: I'm concerned about the ease of opting out of the vaccine, the COVID vaccine. Will people who are not vaccinated be required to test regularly for COVID?
That is a decision that is not yet made. It is one that is discussed and was discussed at 4 o'clock this afternoon again. So I know that the university is monitoring that. The other thing we do at the University of Oregon is we work really closely with our Lane County Public Health Officer, Dr. Pat Ludke. And so when we start making decisions about things like this, whether we should test individuals who aren't vaccinated, whether we should wear masks indoors or not, we oftentimes are collaborating with him really, really closely and getting his professional opinion. And then likewise, we have Dr. Richard Brunatter, who's our chief medical officer, who sits in on these meetings as well. So we are putting a lot of heads and knowledge together on this, on these kinds of decisions. And that particular decision has not been made. So I would encourage you once again to watch the communications that go out through the University of Oregon.
Thank you. So I just want to wrap up really quickly. We have several comments in here that I want to share in just a second. For those of you who are watching, maybe you joined late or you maybe didn't hear an answer that you'd like to get more on, our Parent and Family Introduction webpage has 2 pre-recorded videos on this topic, on these topics, I should say, one specifically around student health insurance and the other on the general services of University Health Services. We will also post this recording next week as we have the opportunity over the weekend to clean up the timing on the captions so that if you need the closed captions that you can read them as the words are actually being said. Sometimes we have to work on that a little bit. So we will post this for you. And it is something that is worth getting repetition on because these things are so complicated. Some of them we have feelings about, some of them have been politicized. It is perfectly okay for you to continue to ask us these questions. So if at any point you need more answers, please reach out either to me in the emails that I have provided you with my contact information or through the contact information that I've provided here in the chat. I'd love for you to make sure that you get your questions answered on these topics. So with that, I just want to say that you have lots of kudos in the Q&A, some from healthcare providers, others who just feel like they've gotten a warm hug from you all around the care for their students. So thank you for being here. Thanks so much. And I know it's a lot to ask you of your evening in the summertime, so I really appreciate your time.
Happy to do it. Thank you, Cora. And I would just say, please call us or email us for anything. We are working Monday through Friday right now, all summer long. So we are here to answer any of your questions. You don't have to have this be our only engagement with you.
That's a great way to end. Thanks so much.